My name is Dr Bob Ryder from City Hospital in Birmingham, and I'm reporting here the 2-year outcomes with regard to 90 consecutive patients with long-standing poorly controlled type 2 diabetes and obesity treated with EndoBarrier in Birmingham. This is an EndoBarrier, a 60 centimetre impermeable sleeve which is implanted during a simple endoscopy procedure into the first part of the small intestine, such that the food passes through it rather than the small intestine, and it mimics the bypass bit of the Roux-en-Y bariatric procedure. We provided EndoBarrier to 90 patients with type 2 diabetes and obesity suboptimally controlled by standard therapies, and we monitored outcomes during the treatment with EndoBarrier for 1 year after removal of the EndoBarrier. These are the baseline characteristics of the 71 patients who turned up for their review a year after removal, and you can see that their baseline BMI was over 41, the hemoglobin A1C was over 78, they'd had diabetes for a median duration of 13 years, and nearly 60% were taking insulin. And this is what happens during the period of EndoBarrier treatment. The weight fell by nearly 16 kilograms. The hemoglobin A1C went from 78.1 to 58.6, and this was alongside improvements in blood pressure, cholesterol, a marker of liver fat, and the requirement for insulin. But of course the interest is in what happened after we took the EndoBarrier out. Well, I can report here today that 45% of them maintained the full improvement that they achieved during the year with EndoBarrier. 35% sustained a partial amount of that improvement, with 20% deteriorating to baseline. And these are the figures behind the statements that I've just made, and you can pause the presentation at this point if you wish to study the figures, but I would like to point out in particular that of the 20% who deteriorated back to baseline, 71% of them had depression or bereavement. 13 of the 90 patients had required an early removal because of a serious adverse event, as listed here. 5 had a GI bleed, 3 a liver or other abscess, and 5 had GI symptoms. But I would point out that all made a full recovery, and most derived considerable benefit despite the early removal. And it was noteworthy that in a number of these patients, the problem could have been avoided by full compliance with advice given, such as these examples here, which you can study at leisure if you wish to pause the slide. I'd like to point out that there was a considerable reduction in the requirement for insulin, and nearly a quarter of the patients were able to discontinue insulin, such as this patient whose BMI went from 39.3 to normal. Her hemoglobin A1C went from 128 millimoles per mole to 49 millimoles per mole, and her requirement for insulin went from 260 units a day to requiring no insulin, and you'll see that improvement was continued a year and a half after we removed the EndoBarrier. So in summary, we've demonstrated that 80% of our patients were able to maintain the significant improvement 1 year after removal of the EndoBarrier. Over a quarter of the insulin-treated patients were able to discontinue insulin, and of those who deteriorated back to baseline, 71% had depression and or bereavement. There was very high patient satisfaction, and we believe that our data supports the risk-benefit with regard to EndoBarrier being strongly towards benefit, and as endoscopy units are ubiquitous, we believe that delivery of EndoBarrier treatment could be relatively straightforward. I thank you for your attention.